Good afternoon, everyone. My name is Sophia Pfiffner, and I'm the president and CEO of the Columbus Metropolitan Club. And it is my pleasure and honor to welcome you here to the Ellis. For those who are on our live stream, welcome to today's conversation. We are here to support your not-for-profit, the Columbus Metropolitan Club here in Columbus, Ohio. Speaking of supporters, we are so grateful to the presenting sponsors of today's conversation of the longest-running Optimal Health series, The Ohio State University, Wexner Medical Center, OhioHealth, and Nationwide Children's Hospital. We'd also like to thank today's sponsors, AstraZeneca and Cardinal Health, and of course, the Ellis, for hosting us. Last but not least, thank you to the presenting sponsor of our live stream, the Center for Human Kindness at the Columbus Foundation, our live stream partner, the Columbus Dispatch. Every CMC conversation takes a village, so thank you everyone for supporting today's conversation, and especially thank you for being here. All right, well, welcome to today's conversation, Prescription for Equity, Creating Access to Healthcare in Central Ohio. Our region is home to global leaders in healthcare, but access to healthcare remains uneven in Central Ohio, as it is in much of the country. With a panel of passionate leaders, today we'll dive into the true cost of uneven access to healthcare here in Central Ohio, and how the doors to quality healthcare can be opened for all. But before we start, let's give a wonderful round of applause to some of our panelists. First, we have Dr. Chyke, Chief Health Equity Officer at The Ohio State University Wexner Medical Center. Carrie Harris-Muller, Senior Vice President and Chief Population Health Officer with OhioHealth. Amy Rohling McGee, President of the Health Policy Institute of Ohio. And Kate Tullio, Associate Vice President for Health Equity with CareSource. And last but not least, our host, Angela Dawson, Executive Director of the Ohio Commission on Minority Health. Angela, we look forward to today's conversation, and the podium is yours.
Good afternoon. I have a bilateral significant hearing impairment, which is a wonderful way of saying she can't hear. Good afternoon. Thank you so much. We are so excited this afternoon to be talking about something that matters to everyone in this room. Today, we have the opportunity to discuss healthcare access, which is timely use of personal health services. It is the ability to achieve optimal health, and this requires coverage, quality services, timeliness, and a qualified workforce. I know we have a panel who can speak to that this afternoon. In this discussion, we are proposing that creating equitable access is a prescription for our efforts toward health equity. We also recognize that access alone is not sufficient, but it is an important, key, and essential step. In general, health equity is the ability for everyone to achieve the optimal level of health. And for the purposes of today's discussion, we are talking about systemic drivers of health and the ability for the systemic system to address health equity. According to Dr. Kamara Jones, former president of the American Public Health Association, health equity is the assurance of the conditions for optimal health. This requires organizations, health systems, payers, and all levels of government to advocate for healthcare access, promote equity in care, increase diversity in the workforce, and influence historical barriers and structural determinants of health. I am so pleased to have this opportunity to dialogue with system leaders, these outstanding men and women who will share their efforts with you this afternoon on how we can work together across systems to create equitable health care. So let's jump in. Central Ohio is home to global health leaders in healthcare, but access remains uneven in the region, as it is for much of the country. So how does Ohio rank compared to other states, and just how large is this inequitable access challenge? Indeed, we need to know what we are facing and where we are. Ms. Amy Rohling McGee, will you start us off with our health ranking and give us some background on that issue?
Sure. Thank you so much, Director Dawson, and thank you to the Columbus Metropolitan Club for the invitation to be with you here today. It's an honor to be in a room with people who are dedicated to making sure that every Ohioan has what they need to reach their full health potential. So thank you, and thank you for your question. Ohio ranks 44th on health value. This is a measure that takes into account both how we're doing on health overall as a state and what we spend on health care. Healthcare spending is often, not always, but often a reflection of the worsening of health conditions, many of which could be prevented by dedicating more resources and our strategies towards upstream prevention. So we're near the bottom, ranking 44th compared to all states in the District of Columbia on health value. We're spending more than people in many other states, and we have poor health outcomes.
Thank you so much. That is indeed a challenge, but each of you have a commitment in your organizations to have an impact. So in Central Ohio, each of you are focused on access. So if you could very briefly give an overview of the efforts that you are making to improve access to Central Ohioans at your organizations. Dr. Doubeni, start us off.
I am closest to you, so I get to take the mic first. It's really exciting to be here, and it's my first time here. And looking at the audience, it's inspiring to see your commitment to this issue. So I am the Chief Health Equity Officer for the Wexner Medical Center. I want to acknowledge that my Dean Bradford, is also here, as the rest of the team here. So at the Ohio State University Wexner Medical Center, we are a land grant institution, which means that we are committed to the mission of serving the entire state of Ohio. But I know this conversation is about Central Ohio. And one of the key ways in which we are doing this, and going back to the points you raised, is health is inequitable for many, many, many reasons. And much of it is driven by the proximal or upstream issues that drive health access and wellness. So whether you have access to health resources, and to wellness resources. So the one key thing that we're doing is part of our strategy, and for many, many years, this is not something that I started, but many years at Ohio State University Wexner Medical Center, we've had a focus on health equity. So in the office that I help to lead is focused on looking at not just the healthcare access, but also the workforce, as well as community engagement, because I want to emphasize that community engagement is an important piece of what we do. And one piece that we have put in place recently, in addition to the broader work that we do, is what we call the Healthy Community Center on Near East Side. If you haven't seen it, I will invite you to take a look at it. If nothing else, please grab a food from the cafe when you're there. For many reasons, we did so because health is not just about coming to the doctor. You made a point about healthcare expense. I think you made a point about healthcare expense. Because when you get sick, it's often a little too late. We want to be able to prevent health and make people healthier. And so the office helps to promote access to care. We identify areas in which there are gaps, and we work with my partner, looking at me here, to create work streams to address those healthcare issues. The one piece I want to say before I move on is our biggest challenge in terms of delivering care is the workforce. We have had, and I think you have the numbers, we've had a big deficit in the number of primary care physicians in Columbus alone. And that has to be an important area of focus for all of us, because it takes all of us to get the workforce here to provide the care that we need. Our primary care workforce is really strained and constrained.
Thank you. And Ms. Harris-Muller, can you expand on the work that's being done at OhioHealth?
Sure. Thank you. So OhioHealth is very much focused on our ambulatory strategy. So as you all know, we have many different hospitals. Our whole goal is to ensure that we have hospitals as well as ambulatory primary care and specialists within the communities that we serve today. We've done a really nice job over the last 20 or 30 years with a single playbook. That playbook is now evolving to ensure that we have the right capabilities, the right clinical physicians in the communities that we serve. We can't do that all by ourselves, so we are really focused on partnerships. Partnerships are important to us. We have deep partnerships with Dedicated Medical Center, which is a Chen Med organization. So it's really important for us to ensure that we have primary care in the communities that we serve, and that we create some innovative approaches to ensure that the residents in those communities are receiving health care. We also have mobile units, and it's wonderful to have those capabilities where we can deploy those in the communities that we're serving as well. So as we're thinking about quality, for example, and closing a care gap in mammograms, we have the opportunity to utilize different assets within our delivery system to ensure that all women in that community are receiving a mammogram, for instance.
Thank you so much for expounding. Ms. Tullio, can you share what's happening at CareSource?
Absolutely. So thank you again for the opportunity to be here today. At CareSource, and if you're not familiar with CareSource, CareSource is the largest Medicaid managed care organization in the state. We're one of 7. And my role is dedicated to ensuring health equity in all that we do. Also, each of the other Medicaid managed care plans I have a counterpart at each of those plans. So we all work together, even though we're competitors, to create that systemically across the state, and I think that's a really important piece. Specifically at CareSource, I think it's tapping into what a lot of my colleagues have already spoken to today. How do we partner with healthcare and healthcare providers, not only to solve access problems for our members, but also some of the problems that we've spoken to, access to get a mammogram. That we have a provider challenge. How can we help develop pathways for providers to create more providers in the state? So bringing that value of having a managed care organization beyond what it brings to Medicaid members, but what it brings to all the healthcare organizations and all the community-based organizations across the state.
Thank you so much. The essence of healthcare is rooted in coverage. One of the things that is of utmost concern certainly is the fact that 609,000 Ohioans have literally lost their Medicaid coverage after the COVID-19 Protections Act was ended last year. Can you share with the audience why this has happened and what your key strategies are for gaining that coverage? So Ms. Amy Rohling McGee, I'm going to ask that you lead that off, because I know this is centered around the work that you all do at HPIO.
Sure. So as Director Dawson stated, there was a provision that was put in place during the pandemic that suspended redetermination for people with Medicaid coverage during the pandemic. Once that ended, then the resumption of the usual process for redetermination began again. Well, as you can imagine, people may have moved, they may have moved several times. Having correct contact information, getting in touch with the people to determine whether or not they were still eligible was challenging. This is where the role of people who serve as care coordinators, discharge planners, people who are community health workers, and people who work in provider offices are critically important, because at least a proportion of the group of people that Director Dawson spoke to may still be eligible. So getting them that coverage and getting them back onto the Medicaid program is important to getting them the care that they need. I will say that even after that redetermination process happened, so like as of today, roughly 1.3 million Ohioans have coverage through a provision or a policy that was a part of the Affordable Care Act. So it's roughly 787,000 Ohioans have coverage through that expansion population, the people who got coverage who wouldn't have had access to the coverage prior to the Affordable Care Act. And then about 478,000 Ohioans are getting coverage through the marketplace, where people can purchase private coverage and get subsidies for that. So it still is a substantial number, 1.3 million, who are getting covered through Affordable Care Act related provisions.
Ms. Tullio.
I want to expand on that a little bit. So this data is from Kaiser Foundation. When you look at Ohio compared to the rest of the states as it comes to disenrollment for the public health emergency, this is still a substantial number of folks, but only about 25% of those who were enrolled in Medicaid in Ohio lost coverage. And that puts us at one of the best states. I don't know if we're in the top 10 with that, but pretty close. However, when you look at the reasons why, for Ohioans that lost their Medicaid coverage, about 70% of those were procedural. So those paperwork errors you were referring to versus, hey, we looked at you, we determined you truly are no longer eligible. And so that is a huge opportunity to make sure that we, and that is the royal we, that is CareSource, that is everyone here today, that is everyone on the panel, are educating folks about what their options are and how to do that. And I know that's easier said than done, especially the process to re-enroll, but there's a lot of folks out there that are still eligible.
Certainly. Ms. Amy Rohling McGee, I think you brought up such a significant point. The importance of systems connecting to navigators, also known as community health workers, patient navigators. And it is so important because community health workers have the boots on the ground, and they indeed are able to do what systems aren't able to do through relationships. And so my name for them is also equity drivers, and I know we have some of them in the audience today. But we know that this is another example of how partnerships and being able to expand that medical team to include patient navigators is so important. So one of the other things that you talked about, Ms. Amy, was the Affordable Care Act. Certainly something that is on the mind of everyone is what happens if the Affordable Care Act is repealed? What does that look like on the landscape for Ohio, and how will those individuals who are covered gain coverage, and what will happen with them in essence? That's a tough question.
Well, it would be the opposite of the number of people that I just stated have coverage because of the Affordable Care Act. So roughly 1.3 million Ohioans would potentially lose coverage. And I can say that because I know that other means of getting coverage have remained fairly stable. So the number of people, or the percentage of people in Ohio who are getting coverage through their employer, has remained fairly stable. So we're talking about people who were previously uninsured. Our uninsured rate for the non-elderly population in Ohio went from 14% in 2010 to 7% in 2022. So all of those people who got coverage would likely lose coverage because unless there was some sort of replacement that continued to make that coverage affordable for folks. And I just want to mention too that many of the people who are getting coverage through Medicaid or through the marketplace are employed. And oftentimes they're employed in multiple jobs. The data tells us that people who make lower wages or who are working part-time jobs, often multiple part-time jobs, don't have offer of coverage through their employer, or that offer is they end up being underinsured or it's very costly. So in practicality, there aren't other options for people who would lose coverage under that scenario.
This brings forward the point of what are the economic benefits of addressing these health disparities? Because I think the research continues to show if we address inequities, if we address these disparities, that there is a significant financial benefit for both the state of Ohio, systems, and local government. Can you speak to that briefly?
Yes, we did an analysis, a comprehensive analysis of the economic impact of eliminating disparities and inequities in our state. Unfortunately, I don't have all the numbers right at the top of my mind, but it was billions of dollars in savings could be realized if we were able to, Carrie, my lifeline, the author, yeah, $80 million, $80 billion could be realized in our state if we were able to eliminate those disparities. And it was millions and millions of dollars in healthcare spending alone that could be avoided as well. So yes, substantial, in addition to substantial health outcome impacts as well, including years of life that would be gained if we were able to eliminate those disparities.
So absolutely, there is an economic benefit, there's a health outcome benefit, and so it then positions our state in a stronger position when we address those things. Dr. Doubeni, jump in.
No, I didn't realize that we're allowed to post a lifeline in the audience, but so team, please,
You have a whole table there.
keep in mind that. So if just look at me. No, I'm curious because, Amy, you said something that struck a nerve as a researcher and someone who has been doing work in different areas in this really in access to care, right? Access to care is more than just insurance, but insurance is important because it gets you the means to ticket into the door. I'm just curious from your data, maybe the lifeline from your audience as well. It'd be interesting to kind of hear what groups in our population are most impacted. I think we kind of know the answer to this, but if you had that information, it'd be interesting to know. It is sort of the black folks, the lower income folks, the working poor, the so-called Alice's from in the past United Way kind of framing. What are these groups who are affected? And one point I want to make too is that, sick workers make very poor workers, right? They just, but it'll be interesting to know what groups you found are most affected by that.
Well, we have looked at whether or not there have been reductions in disparities by race and ethnicity after the Affordable Care Act and Medicaid expansion happened in our state, and there has definitely been a narrowing of those disparities, not an elimination of all of those disparities by race and ethnicity. Also, we know that more people with lower incomes have been able to get coverage because of these factors. But I want to go back to something that you said earlier too about the gaps that still remain in terms of being able to access providers with that coverage. We have seen improvements. There are improvements in the percentage of people in Ohio who are able to get access to care when they need it. But we still see many areas of our state underserved for primary care physicians, behavioral health, so people who serve those with mental health issues and substance use disorders, and oral health providers as well. So, there's a lot of work remaining, and there's a lot of great work underway through state government. There have been funds allocated to encourage people to go into behavioral health and substance use disorder fields and partnerships with higher ed in order to reduce the cost of going to college and especially incurring the loans that might be necessary. So there is work underway, but a lot of work to continue.
Certainly. And we do know from the Group 8 study that the addition of access to health care resulted in an increase in employment. And so I think it's important that we continue to note these benefits so that people understand when people are healthy, people can go to work.
Well, and I wanted just to reflect on something you said earlier, Director Dawson, about access to care being necessary but not sufficient to getting to improved health. Because you might be sitting with a question regarding, if we did all these fabulous things related to access to care, why are we still spending more than many other states on downstream health care? Why is our overall health not great? And I want to talk about all of the factors outside of health care that also influence our health. Researchers have estimated that only about 20% of our health is related to clinical care. You know, most of us are not going to see a doctor or another provider on a daily, weekly, monthly basis. It's where we live, it's where we work, it's where we recreate. All of these other factors are much more substantial contributors to our health. They can either support our health or impede our health. They can enable us to make healthy choices and engage in healthy behaviors, or they can get in the way of us being able to engage in those. So in Ohio, we do not perform well on metrics related to all of those social, economic, and physical environmental factors that influence our health. So we need to be doing kind of both and. Improving access and addressing these other drivers of health.
Absolutely. We know that access to health care is deeply intertwined with what we refer to as social determinants of health. And those are the barriers, whether it's housing or transportation, whether it is income, whether it is safe and affordable places to live. Ms. Harris-Muller, can you talk a bit about what our partners are doing to really drill down and help the people that you serve address those barriers that we call social determinants of health?
Thank you, Director Dawson. So I talked briefly about partnerships, and one of the things that, I mean, reality is many of our Medicaid population are uninsured, or the ACA population have one vehicle to get health care, and it's really sick care, and we see our emergency rooms being flooded with individuals who just need to get their blood sugar checked and reevaluated. So OhioHealth is very focused on, as I said, partnerships. We are focused on working more closely with community health centers. As our patients are entering the emergency room, they don't have a primary care physician. Our care management team and our navigators are connecting them to a primary care physician. And many of these individuals have no idea what kind of coverage they have and how they should leverage that coverage. For example, we've been talking about transportation. They have no idea that they have a transportation benefit. Our care managers and our partners within the community health centers are teaching them how to utilize those benefits, and it provides them with a sense of independence. So that would just be one of my examples. And we cannot let the ACA be repealed. That's on all of us. We need to ensure that it does not get repealed.
Certainly, businesses are increasingly being called on to address this work through an equity lens. So, Ms. Tullio, can you share some of the innovations that you are seeing when it comes to the private sector, when it comes to business partners, really looking at improving access overall to care for marginalized populations?
Absolutely. Can I take a circuitous route there, though? I promise it all ties in. All right. So as we talked about some of these barriers to access, whether it's insurance, whether it's lack of providers, I think another one is even when we have all those things, just like we talked about, the doors can be open and people are still going to feel like they can't come in. And so this lack of trust, in large part due to discrimination, marginalization, and racism, plays a huge part. This was not in Central Ohio, but I was working with some providers in another space, and they were surveying members of the Hispanic and Latino community to understand what healthcare providers they used in the area and what they liked about those. And overwhelmingly, for one of the facilities, they said, oh, they have wonderful, top-notch care. We're not supposed to go there. That's not for us. Over and over again, that was expressed in the verbatims, that they were supposed to go somewhere else. And the provider was baffled because they didn't understand where that came from. And so I come back to that because in addition to some of the innovative things that I see private business and then collaborations within healthcare doing to address things like transportation or workforce development, I think it's also educating and addressing and really trying to change those implicit biases and helping folks understand. I would hazard a guess that most of the folks in the room or online today understand this and are bought into this concept, but it's surprising to me how many folks still don't realize that that's a big issue. So back to your question. As it comes to things, I think one of the things I would hold up, and it's an example of something CareSource does, but it's certainly not the only one, is things like, oh, there goes my statistics, I'll get them, is our life services program, thank you. So helping connect folks to workforce development, to education that are enrolled in Medicaid with the idea that eventually they will no longer need Medicaid. But I think also partnerships for things like, when we talk about transportation, that tends to be the #1 barrier. And we hear a lot of complaints about that across the state. So how do we get a little more innovative about that? Partnering with Uber and Lyft, that could work. Also, we're working with providers, for example, who are like, you know what, we're going to buy our own transportation and we are going to drive to their houses and we will pick them up there. And that also comes back to the idea of addressing the trust, that we literally will come pick you up to bring you to our facility.
Absolutely. One of the things that we talked about was social determinants of health. But we also need to talk about structural determinants of health. Those things that are deep-rooted, they are historic, discriminatory. It's really about the distribution of power, money, and resources. And so many times, individuals in the audience and online may be saying, I'm not really getting why we're not moving the needle. And more often than not, we can provide transportation and we can assist in housing, but we really have to come to terms with some tougher conversations that really talk about how do we deal with those historic and contemporary barriers that we call structural determinants of health. For marginalized communities, oftentimes we will hear nothing for us without us. So I really want to hear from you all. What are you doing to really engage communities from the beginning, at the inception of the ideal, so they are creators of the solutions that can help to heal and move communities forward? Dr. Doubeni.
Since I'm closest to you, I guess I'm going to start. No, that's a topic that is really dear to my heart. I want to describe myself as a student of community engagement. And many of our organizations across the country do something around community engagement or believe or talk about community engagement. But before I go there, if I can make a slight detour, because I think it's really important to your framing of health equity. Sure. Yes. It's going to be short. It's going to be really short. It's about health equity, but how you tie the pieces together, right? You talk about Ohio as having one of the worst indices in healthcare, but health equity, to your definition, in my mind, and it's important, comes to 3 things, right? We have to be able to give access to the best care possible anywhere, because any care that is not good enough is not going to get us to health equity. It doesn't matter where you have access to it or not. The second piece about it is what we're talking about, is inclusion in that healthcare. And that inclusion is has tentacles all over the place, right? But the third piece is what we also talked about, is social determinants of health. And Dr. Mammoth framed it this way: do not return people to the conditions that made them sick in the first place, Because if we don't identify and address those social determinants of health, we send them back home from the hospital. We are surprised when we see them back, right? And say, oh, I'm getting worse, I'm coming back. Anytime you come back to the hospital, your risks of bad outcomes just gets worse and worse and worse. So those are the ways that we are framing our approach at Wexner Medical Center. Now, so I'm just going to cut to the chase. We have 2 advisory boards that we have in place for the Wexner Medical Center. One is in the Near East Side that actually helped to co-create the community engagement, healthy community center, Lifeline place, the Healthy Community Center, which is designed to be a place to promote wellness, access, even an innovation kitchen, a catalytic kitchen, right? Test kitchen. Help me out, Javante. But it is meant to be an incubator. That's the word I'm looking for. Because all of these are terribly important. It's one piece that is really important to what we do. The second is actually a group of stakeholders. Some of you may be in the audience. Mid-Ohio Food Collective, Public CPH, Foundation of Appalachian Ohio. And the reason we do so is that we know we can convene people, because as a healthcare system, we can do so. But without the partners who are working with us on food, transportation, housing, we cannot actually effectively influence and change or improve those things. Education is really important, right? So that's what we do. And so our health equity strategy was actually co-created with the community. They edited sections of it, told us where they thought we were doing wrong, we changed it. And what's our principle to even a new strategy is to continue to co-create with the community. And my other partner here is Stephanie Milburn. Yeah, we work with her closely.
So I'm getting this signal. You see, Mr. Doug, I'm just going to turn my head so I don't have to. I'm not looking at him. I'm not looking. So there's a saying that says, may the work I've done speak for me. Each of you play a unique role in your organization as equity leaders. That's the individual who's at the table who says what people wish they wouldn't have said. They keep bringing it back up, no matter how many times they put you on the parking lot and say, we'll come back to that later. It is the individual who more often than not is pushing that system to go further to address these issues of equity. Share very briefly your greatest challenge for your organization to achieve equity and your greatest joy in your equity work. I'm going to start with Ms. Tullio.
No pressure. I'm just going to react. The first thing I started thinking about that is the greatest challenge, and the thing I think we need to do the most, again, royal we, is find a sustainable way to pay community-based organizations for their work. Bake that into rates, bake that into how the medical system pays. And it will be my greatest joy when we get there, but I think it's one of the greatest challenges because that's who are bringing our most marginalized community members to healthcare, to addressing their health-related social needs. So for me, it would be that.
No, that CMC has a wonderful history of taking questions from the audience, both online as well as in person. So if you are watching online today, we want you to put your questions in the chat. And then, of course, if you are present here today and you have a question, we're going to ask that you go in the back of the room where Mr. Doug is and line up so we can take your questions. So go ahead. Ms. Harris-Muller, share.
So what I would say is that OhioHealth can't do it alone. I think that we, as I look at the panel, there's competitors up here, and we need to not compete when we're focused on bringing those numbers up, right? So how can we do a better job at partnering and ensuring that we have the right partners in our communities, that we're embedding navigators and social workers in our communities to build trust, and then more importantly, as we're hearing from our communities, being able to convene the right partners around the table to make healthcare more accessible and to provide prevention and wellness.
Wonderful. Miss Amy, I want you to bring us home in 30 seconds.
Being concise is not necessarily my strong suit. Well, I just wanted to say that the biggest stressor is that there is lots of room for improvement. Our health value dashboard, which I hold here, has over 100 metrics, and Ohio does not perform well on many of them. However, we know that improvement is possible. There are states that are doing better than us. There are evidence-based strategies we could all be deploying more of us. There are more collaborations and partnerships in which we can all engage. And I think that brings me to where I also experience the greatest joy is working with my colleagues and with others like you, Director Dawson, to address these challenges.
And in 30 seconds, 15 seconds, Dr.
Seconds.
Doubeni,
Sorry.
I only want to know your greatest joy in your equity work.
My greatest joy is having a leadership team that understands health equity, and I don't have to explain that or define that to them. The biggest challenge, since you gave me 10 seconds more, sorry, is that how do we talk about partnership and working together in theory. How do we actually make it happen? Have a table in which all of us are sitting around and doing things. AstraZeneca is there to partner with us. CareSource is there. How do we actually make this sustainable and make progress further?
Very good.
Not short enough.
And again, I know that Mr. Doug is in the back curating questions for us from the audience. And so, Mr. Doug, what is our first question?
Angela, thank you very much. Thank you to today's panelists. Great conversation. If you do have a question, please do join us here. We already have a lot of questions and not much time remaining, so we'll try to go quickly. Great questions at CMC. Take less than 30 seconds to ask, and they end in what punctuation mark? A question mark. Yes, they do. Thank you, everyone. I'll launch us off with this one. There was a WOSU radio story this morning about pharmacy deserts, or neighborhoods that don't have access to pharmacies. Columbus has great resources like Lower Lights that bring pharmacies into underserved areas. What's the role of these kind of community caregivers in promoting healthcare access? How can we have more of them?
Who's going to take that question?
They're huge, especially for pharmacy. And I think the role of a pharmacist is one we don't talk about and not necessarily in these spaces, but can be a huge benefit to community education about health. I don't have a whole lot to answer other than it's much needed, and I think we need innovative solutions like that.
Yes, hi. I'm Bill Wayhoff with Steptoe and Johnson. And I just have a question I've been wondering about since the ACA, and not necessarily causative or anything like that. Are there more the same, about the same, or less neighborhood primary care doctors than there were before the ACA? And again, there could be multiple causes. I'm just saying, just as that as a bright line date. Does anybody know the answer?
I don't.
I don't know the answer right off the top of my head, but going back to our dashboard, our first dashboard was produced in 2014 and used 2012 or 2013 data. We've kept the metrics largely the same over the course of time, and they're all available on our website, which is hpio.net. So you could go back and look at that one from 10 years ago and see what change has happened since then. Thank you for your question.
Thank you. Next question.
Hi, good afternoon. What a great panel. My name's Erica Clark-Jones. I serve as the CEO for the Franklin County Alcohol, Drug, and Mental Health Board, and also on Dr. Doubeni's Health Equity Committee. This question, though, is really, honestly, Amy, where you left off. And you've been doing this health dashboard for many years. Are there, and you say you're hopeful, for where we can go, lots of things we can improve upon. Have we seen communities who once were further down on the equity scorecard list, or when it comes to healthcare equity, do better over time, and what 2 or 3 strategies, jump out at you that we could employ in a better degree here in Central Ohio? Thank you.
It is a complicated question. In fact, when we've gone to other states that have done better or have improved on key outcomes like infant mortality and reducing the racial disparity in infant mortality, and asked them the question of what did you do, they have said, we don't know. And often they're surprised that they are doing as well as they are. Because if you think about each of us, I would venture to guess that most of you can think of more challenges or things that need to be done than you can think of your own successes, the successes of your system, because we often don't spend our times looking back and assessing what's worked or what's not worked. But to answer the question that you asked as best I could, I think where we've seen improvement goes back to the remark around how to do collaboration and partnership is collective impact models where a variety of partners come together, define their outcomes, and work together continually on an issue, commit resources to it too, because there's often an issue of the day that gets attention for a limited period of time. It's not enough to only focus on something for a year or 2 or even 5. It can take 10 plus years to make progress on these issues. It took decades for many of these issues to develop and to worsen to the degree they are today. And I can't emphasize the importance of evaluation enough. We will often identify problems, we'll even identify solutions, but then committing the resources to evaluating what we do and establishing healthy environments in which we can ask questions about what's working, what's not, and why, and then maybe turning in a different direction if something isn't working. All of that doesn't happen enough. So it's not really like a issue-specific strategy, but more something that could be applied to multiple topics.
Certainly. And I think it speaks to the issue of the need for us to develop solutions that exist beyond us. You cannot have deeply embedded historical disparities without being able to plan intentionally over protracted periods of time that go beyond your existence, your position, your administration. And so a rising tide lifts all boats, so that we have invested and the tide is rising. But if the structural barriers are creating holes in your boat, you are technically bailing water. So we really have to get beyond ourselves and plan ahead to say, what will they say of me when I am gone? And the work that you have to do today has to go beyond your position and your opportunity. But talking about cross-system planning to stand up and face historical barriers that have been the defeat of good outcomes, not just in this state, but across this country. But people are doing good. And we have to be able to learn from others and be able to implement across time. Doug, other questions?
Thank you so much. From the live stream audience, Carol Looper wants to know, mental health professionals are in great demand, especially for children. Is there an effort to train and recruit these professionals?
Yes, there is. I'm going to acknowledge the former director of the Ohio Department of Mental Health and Addiction Services, Lori Chris, who's here today, for her work in establishing a program called Great Minds, is that right? Which is a partnership between the state and higher education to recruit and train and provide tuition reimbursement for people to go into those fields. So it's very, we need to make sure that more people know of that opportunity and are encouraged to go into those fields, because you're absolutely right that there is huge unmet need, and in particular related to children and youth.
Yes, sir. Next question.
So I'd first like to thank Doug for moving this to Doug height to Jason height. Much appreciated. I'm Jason Coma. I'm the Executive Director of the Charitable Healthcare Network. We're the state's network of free clinics and charitable providers. And I would like to provide a supplemental answer to the first question that leads to my question. There will be a question mark, Doug. I'd like to recognize Taylor Reed with the Charitable Pharmacy of Central Ohio, whose sole purpose is to provide access to medications to the most vulnerable in Franklin County and in our communities. And that leads to my question of how folks like Taylor or the other providers that we have across the state that are delivering 100,000 plus patient visits of 700 plus, nearly 700 plus healthcare services around the state, all for free or little to no cost. How do we better connect with the traditional healthcare system so that together, back to that conversation that was mentioned, together we can all advance the health and well-being more forward? That's not to say that we don't appreciate the partnerships we have, but how can we be part of the conversation moving forward?
So I know the Health Policy Institute of Ohio did quite a bit of work, and I advise you all to look at their work, the connections between criminal justice and health. Those things are so key. So very briefly, Dr. Doubeni?
And I think that feels like existential question. It's not so much that the connections are not necessary or are not happening. They're sustained. I would say talk to any one of us on how we do that work together. Within our institutions, we're very large entities. Wexner is a big place. OhioHealth is a big place. But we have an Office of Health Equity that's designed to solve that problem by being a point of contact. And I bet that OhioHealth has the same thing. So we hear from you, and I think we just need to connect and talk about it. We have a shared problem, and
I want to let you know that it's been a wonderful conversation this afternoon, but our time has ended. I am so glad to be able to bring up Ms. Sophia Pfeiffer to close us out this afternoon. Thank you.
Thank you so much. What a wonderful conversation. What a great group of questions for an incredibly important topic. And when I think about some of the things that were discussed today, how do we make it happen? How do we make it happen? I think it's easy to tune into today's conversation and think, oh, it's just the institutions that will work on this and it will magically solve itself. But I'm going to invite everyone in the audience today, our panelists who are continuing to do great work, and those who are tuning in through our live stream or afterwards on our podcast to think about today's conversation and think about how you can lean into, one, continuing this dialogue with your friends, your family members, your coworkers, continuing to educate yourself on a critical issue to our community, and then most importantly, what actions can you take to solve this? Because it's not going to happen with a panel of wonderful, wonderful individuals of 4 people. It's going to take this entire community. So, thank you to our presenting sponsors for the CMC Optimal Health Series, the Ohio State University Wexner Medical Center, OhioHealth, and Nationwide Children's Hospital. We'd also like to thank today's forum sponsors, AstraZeneca, Cardinal Health, and the Ellis. And we are so grateful to our presenting sponsors, the Center for Human Kindness at the Columbus Foundation, and our live stream partner, the Columbus Dispatch, and a very, very special appreciation to today's speakers, Dr. Chyke Doubeni, Carrie Harris-Muller, Amy Rohling McGee, Kate Tullio, and our host, Angela Dawson. Let's give them all a round of applause. Oh, my friends, but wait, there is more. Okay, so the Columbus Metropolitan Club, our goal is to connect people and ideas through community conversation. Every single week we host an important conversation, and I couldn't think of a more important time than right now to our mission. Our whole mission is focused on civility, right? On civic engagement, on civic discourse. We don't have a forum next week. You know why? We have an election coming up, a really critical election. I am going to ask you to make sure you have a plan to vote. The last day for early voting here in Franklin County is Sunday. Election Day is Tuesday, November 5th. If you have questions, if you live in Franklin County, you have questions about big issues, like Link Us, we had a forum about it. We'll make sure you can find it on our website. If you have questions about gerrymandering, we had a forum last week about that. Great conversation and a great resource to share with your community members and your family members, your coworkers, about issues that are critically important. So please, please, if you care about equity, please go out and vote. And then, after you vote, but wait, there's more. We're so excited to welcome you back. We have a really important conversation. When we were thinking about what is going to be the mood of our country and of our community after November, after Election Day, we wanted to make sure that we had a space for healing. Because regardless of your ideology, regardless of who you vote for, we as a community need to make sure that we continue to march forward. So, November 6th, we have a critical post-election conversation with the Reverend Naomi Tutu. She's the daughter of Reverend Desmond Tutu. She will be here in Columbus for a one-on-one conversation. You do not want to miss this. So please, thank you so much for being here today. Thank you for an amazing conversation. And please come back in November. We can't wait to host you right here in the Ellis. Thanks so much.